Good afternoon, everyone. I'm Amy Gorin. I'm the director of InCHIP, and I want to welcome you to the first of 4 panel discussions that we're having this fall, showcasing COVID-related research. So back in March, right after the university closed down and everything sort of turned upside down, InCHIP launched a rapid response seed grant mechanism to understand the social and behavioral aspects of the pandemic. And it generated a tremendous response. We got lots of applications, and we were able to fund a total of 20 teams through that initiative. So in our panel discussion today and over the next couple of weeks, we've invited many of the seed grant winners to come back and share some of their preliminary findings. And given today's focus on emerging adults, in addition to hearing from 4 seed grant teams, we're also joined by colleagues in student affairs and public safety. And many of us worked in partnerships with these units over the summer and the fall to inform the university collective response to COVID. And I'm thrilled that these colleagues can join us here today to share some of the work that they're doing on the ground. It's incredibly impressive, and it's allowed us to stay open. And really, we're doing great compared to our peers. And they're going to share some of the things that they're doing on the ground at UConn to support our emerging adults as they face this new normal on campus. So we have a total of 5 presentations today. At the end of the presentations, we're going to have a Q&A session that Debbie Corman, InCHIP Associate Director, is going to moderate. And we just ask that you hold your questions to the end. You're welcome to put them in the chat section as we go along, but we'll turn it over to Q&A at the end, and Debbie will take it from there. In fact, I'm going to turn it over to Debbie right now, and she can introduce our first team of presenters. And just thank you all for joining us. I'm really excited to hear some of this research.
Hi, welcome again. I'm Debbie Corman. As Amy said, I'm very excited to introduce Beth Russell, who's the Associate Professor of HDFS, as well as the Associate Department Head for Undergraduate Studies, and she's also Director of the Center for Applied Research and Human Development. She will tell you who else is on her team. The title of her presentation is The Impact of COVID-19 on Young Adults, Coping with Anxiety During the Early Months of the Pandemic. Take it from here, Beth.
Debbie, thanks for the introduction. Again, my name is Beth Russell. I'm an Associate Professor in Human Development and Family Science. Today in our meeting, joining me are my co-PIs on this project, Drs. Crystal Park and Michael Fendrich. We also are including 2 of our amazing research assistants on this particular talk today, titled The Impact of COVID-19 on Young Adults, Coping with Anxiety During the Early Months of the Pandemic. So we know from the literature coming out from these first few months since COVID-19 hit the US that young adults are reporting pretty high rates of psychological distress. Some early evidence suggests that this is particularly true for women. 25% of individuals are reporting increased symptoms of anxiety, depression, and maladaptive coping responses, including substance use, behavioral disengagement, and avoidance, for example. We also know that post-traumatic stress disorder is common after both community-wide crises like our pandemic, but also natural disasters. What we don't know is how quickly those symptoms set in or patterns of their emergence across subgroups. So with some of those curiosities that shape the research questions we'll try to get through today. Some other considerations from the literature include gender differences in coping. And of course, we're seeing social determinants of health and well-being create significant differentials in mental health outcomes, particularly those associated with economic status. As a point of interest, the unemployment rate here in the United States broke 14% this summer, which is the highest it's been in many decades. So it's worth noting that the national enduring trends in unemployment and its psychological consequences are probably certainly true here during the pandemic, where we see people of minority groups impacted more so than white folks, and certainly also age and gender effects there. The current study actually follows a sample of over 1,500 US participants over 4 completed waves now. Each of those was spaced roughly every 30 days, starting April 7th. April 7th was 3 days before the first peak in new COVID diagnoses here in the United States. Of course, since then, we have blown those records out of the water, but the data we'll be presenting today are from that baseline moment in April and 30 days later. Our 5th wave of data, the final for this study, so far at least, will be collected in November, shortly after the general election. Analysis today focuses on the longitudinal sample from baseline to 30 days, approximately 900 individuals, and of those, 189 of them were young adults between the ages of 18 to 25. We'll be exploring associations through path analysis between baseline cumulative COVID-specific stressors, dysregulated emotion coping strategies, and their psychological distress 30 days later. Quickly, I'll put up a few descriptives of the sample. I've broken it out by age group here, so you can see in that middle column the young adults we're all interested in today. And our key measures of interest. Crystal, Michael, and I and the rest of our team published the COVID-specific stressor scale this summer. It is a set of stressors that fall across 3 conceptual groupings, although you can also use a total score across all of them. Those groupings are infection-related stressors, resource and finance-related stressors, and daily activity stressors. Here for these analyses, I am just going to use the cumulative total score, though. We also use the depression and anxiety scales, the BIS-11, the brief COPE, and the impact of event scale, which happens to have, in addition to its 3 subscales for intrusion, hyperarousal, and avoidance distress, a clinical cutoff for PTSD for scores above 33. Some group differences I'll highlight for you real quick. It's interesting to us that generalized stress as measured by the DAS was not as significantly different for our young adults as the COVID-specific stressors. We did see group differences again in depression and anxiety symptoms, as well as in impulsivity, which has particular importance for this age group, given what we know is going on in the normative developmental cycle of, particularly in the prefrontal cortex. We're seeing changes in both behavioral and cognitive impulsivity well into the 20s. And here again, we see the same group differences between our young adults and the older portion of the sample in expected directions, all with Cohen's D's that are above 0.3. So for our path models, we relied on preliminary analyses by bivariate associations to select which we would include in the model. Our sample's not so big for the young adults, at least, to include everything. So we used a rough cutoff of correlations around a 0.3, 0.35 in order to be included in the models. We, again, were paying attention to indications from the literature around gender differences and around those social determinants of health, in particular economic ones. So we were using an item that asked whether or not participants had financial resources adequate to meet their needs on a Likert type scale. We did see group differences on both of those characteristics. I've listed some of them here. I've got a table of them later. If we've got time, I can pull that up and show it to you, but just wanted to give you a brief sense of how we decided what to include in our model. Again, it's going to be a multi-group path analysis by gender. It was fit to the data predicting 30-day psychological distress. Thought I'd take a quick minute and give you the definitions of those 3 subscale outcomes on the IES in case you haven't seen them before. They were new to me. It's a new measure for me. We're looking at hyperarousal distress, which is a high alert body reaction, so very physical reactivity. Intrusive distress or intrusion distress, which is recurring memories and intrusive thoughts. And avoidance distress. And in the end, we'll take a quick look at some post-hoc analyses that look at that PTSD cutoff. Again, that's the score greater than 33 on this scale across those three subgroups. Okay, so here's a theoretical model. Great big mess, lots of lines. But it fits the data well, or at least it's got acceptable fit. You'll see those indices down at the bottom of the screen. Let me go ahead and clean it up so we can have a more interesting conversation. That's a little bit better. You'll see for both men and women, quick tip to some gender coding just to make it easy. The red is for women, the blue is for men. We see significant predictions from COVID-specific stress appraisals to intrusive distress, and then gendered or differential patterns from anxiety, but not depression, interestingly, and not the more general scale on stress included in the DAS. In particular, we see predictions of women's substance use driven by anxiety, and a little bit of a differential down here to get to men's hyperarousal distress. Most compelling to me, though, from our preliminary analyses for this age group is the fact that we see significant impacts when you look at who's likely got clinical levels of distress indicative of PTSD over just 30 days. Those folks above that cutoff have got higher rates of depression and anxiety, as one would expect, but they're also coping more through behavioral disengagement and substance use. So some take-home messages for us as we continue to work with these data, and of course we are still collecting data on into November. COVID-specific stressors, but not general stressors, and anxiety seem to be driving young adults' psychological distress. This is more so for women, just as we saw in the overall literature. In fact, 75% of the population above that clinical cutoff for us were women. We see these notable impacts in short period of time. Again, this is baseline and 30-day data. And that anxiety is playing a significant predictive role over just those 30 days for both men and women. Quick reminder about what that COVID-specific stressor scale looked at: daily activities, infection and resource-related stressors. And our results are kind of echoing concurrent findings that these impacts, particularly on employment, education, and social life, are keenly felt by this age group. Finally, just a couple quick limitations, although there are more than what I could fit in our time frame. We clearly need more representative samples to better power examinations of gender effects. In this subgroup of just 189 individuals, we've got more women than men. In our larger sample, we've got a more even gender split, but we're less representative in other key features, in particular on race and ethnicity. We did recruit the sample using MTurk, which is an online platform. MTurk as a population is thought to be psychologically comparable to the general population, although there's some indication they may be slightly more depressed. A great paper out called the MTurker Blues recently. We did not see evidence of that effect in our data. Clearly, a panel design would improve upon this sort of convenience, crowdsourced sample and help us speak better to generalizability. I want to say a gracious thank you to InCHIP as well as to our NIAAA funding for our group, and many deep thanks to our fantastic team of research assistants, including Rica, Hutchison, and Jessica Becker. Thank you for your time and attention. I'm now going to pass the mic.
Thanks so much, Beth. That was a fascinating presentation, and I'm sure spurred some desire to ask questions and get further information out about it, which we'll do during the Q&A. I want to turn now to Eva Lefkowitz, who's going to do the next presentation. She is a professor and department head of HDFS, and she will introduce her team members, but her presentation is the LGBTQ plus COVID-related relationships and well-being or CREW study. It's all yours, Eva.
Okay. So I'll be presenting data on the LGBTQ plus CREW study, as Debbie mentioned. And I first wanted to say a huge thank you to the team of students who worked on this project with me, shown here. There's absolutely no way this project would have happened without their amazingly hard work. And also thank you to InCHIP for their support, also without which this study would not have happened. So my goals for today are to share the rationale of the study, to provide an overview of the study overall so that you can get a sense of what the data we collected are and what the sample is, to share some preliminary results and then to talk about our future research questions. Luckily, Beth already did a great job of talking about well-being in this age group already. So I am going to tell you specifically that we know that LGBTQ plus youth are at increased risk compared to their peers of poor well-being on a number of dimensions. And this includes depression, anxiety, stress, and substance use. We also know that living in one's parents' home can put these youth at risk. Some LGBTQ plus youth may not be out to their parents, which can restrict their freedom of identity expression. Those who are out to their parents may experience rejection, negative reactions, or low social support from their family. And we know all of these things are linked with worse mental health outcomes. For these students, leaving their parents' home to attend college can sometimes result in better well-being because they have opportunities to express their identity freely, to meet other LGBTQ plus students, and to have opportunities to engage in dating and relationship and sexual experiences. However, the disruption that occurred in March of this year due to COVID-19 may have been particularly challenging for LGBTQ plus students because many of these students had to leave the college environment and return to their parents' home. As a result, for many of them, they may have returned to the feeling of restricted freedom of identity, the feelings of rejection from their parents. And for some, often these students, when they're away from home, may carefully time how and when they come out to their parents with consideration of things like their own safety and possible negative reactions. And an unexpected return home may disrupt these plans for these students. Thus, there's the possibility that these students left a potentially supportive environment to return to a less supportive environment during this time, which may have put them at increased risk of negative mental health outcomes. The goals of the study, as outlined in our original proposal, were to understand things like social distancing behaviors, social relationships, and well-being in this population. And in particular, some of our original research questions were to understand correlates of social distancing behavior, how this social distancing relates to well-being, how family characteristics relate to well-being, what moderates the association between family characteristics and well-being, and also to understand LGBTQ plus students' perception of how the pandemic affected their ability to express their sexual orientation and gender identity. Today, I'll be telling you some of our preliminary results related to two of those points, the correlates of social distancing and family characteristics and well-being. First, I want to tell you a little bit more about our data collection and measures. So we reached out to universities that were public and had large numbers of students and contacted their rainbow or LGBTQ plus centers. And this resulted in a sample of students from around the country, representing 32 different large public universities. They completed surveys on Qualtrics in April and May of this year after the pandemic had begun. And there were a total of 455 students who completed our survey and met all our inclusion criteria. The sample was majority white, but we had decent representation from Latinx students, as well as some Asian and Black students. Because of our inclusion criteria, they were very diverse in terms of sexual orientation. So about 40% identified as bisexual, about 15% as gay, queer, and lesbian each. And then a sizable number of students who identified as pansexual, asexual, or other. Less than 1% identified as heterosexual, and for our inclusion criteria, if they identified as heterosexual, they must have had a gender identity that was other than cisgender. So you can see in our sample overall that almost half identified as women, almost 20% as men, and then sizable numbers identified as non-binary, transgender men, transgender women, genderqueer, and then a number of other gender identity categories that they selected. So we collected surveys online on a number of dimensions. Some of the predictors that we were interested in included COVID protective behaviors like staying home, staying at least 6 feet away from other people and wearing a mask. We looked at living arrangements, so who they had lived with both before and during the pandemic. We also examined their social activities with others in person and at a distance. So at a distance could include things like watching shared Netflix together, or it could be sexting, for instance. And in terms of identity, we asked them about their sexual orientation and their gender identity, as well as if they were out to anyone and the timing of coming out and who they'd come out to. And then questions about their family and friend relationships. So relationship quality with mother and father separately, and social support from family and from friends. And then we have a number of other measures too that assess outcomes. So in terms of well-being, we looked at both existing scales of depression, anxiety, stress, and alcohol use. And then we created items to look at participants' perception of how these had changed as a result of the pandemic. So for instance, how their stress levels had changed since the pandemic had started. And then we also asked open-ended questions about how the pandemic had affected their ability to express their sexual orientation and gender identity, as well as how it had affected their relationship with their parents. We have some other measures that I don't think I talk about any of these today, but they include some moderators, some aspects of romantic relationships, and aspects of their sexual behavior. So in terms of the first research question, which is a paper that we recently submitted for publication, we were interested in understanding what distinguishes students who do versus don't engage in different social distancing behaviors. And so here we have a composite measure of social distancing that includes things like staying 6 feet away, staying home, as well as frequency of going to stores or businesses, getting together with family, and getting together with friends. And what we found is that among participants who identified as men, they tend to engage in fewer social distancing behaviors and were more likely to go to stores and to get together with friends in person than participants who identified as any other gender identity, including women, but also transgender men and women. Among participants who lived with their parents, they engaged in more social distancing behaviors, and they went to stores and businesses and got together with friends in person less, but they also got together with family more. Family outside the home. Obviously, if they're living with their parents, they're seeing them, but additional family members who didn't live in that household. And then we were interested in understanding the wider context of their behaviors. And so we coded for every state that we had a participant, whether there was a stay-at-home policy in place when they completed the survey. And we also looked at how liberal the state was, which we determined based on the percent in that state who had voted Democrat in the 2016 presidential election. And what we found was that participants who lived in a state with a stay-at-home policy and a more liberal state tended to engage in more social distancing behaviors and tended to get together with friends and family in person less frequently. And for the liberalism only, those participants also tended to go to stores and businesses more frequently. So overall, some of the takeaways that from this study include that these kinds of policies, in this case, statewide policies, seem to matter for individuals' behavior, and that when we're looking to see who is at higher risk of engaging in risky COVID-related behaviors, we see that men and people who do not live with their parents tend to be at higher risk. In some more recent analyses that we've done that we just submitted for presentation at a conference, we were interested in understanding how characteristics of the family relate to students' well-being. And we found that for these LGBTQ plus students, having a relationship with their mother that was marked by more positive and less negative affect was associated with less perceived stress and less increase in stress. And we found the same associations for the relationship with the father. And then we also found that having social support from family and friends was associated with less stress, and for family only with less perceived increase in stress as a result of the pandemic. We did not find any associations between whether they were out to their mother or father or not, and whether they lived with their mother or father or not. And so we believe that these data suggest that it's really these emotional aspects of these relationships rather than the status aspects that seem to matter. But we definitely want to do more moderational analyses to see whether in the context of the relationship, these things matter more. And I am just about out of time, so I'm going to very quickly tell you about some of our future hoped research questions in addition to those I shared at the beginning. And those include wanting to look at how sexual behavior and pornography use changed as a result of the pandemic, what kinds of in-person and distance social behaviors participants engaged in with their romantic partners during the pandemic, aspects of breaking up or relationship dissolution that occurred due to the pandemic, how internalized stigma about being LGBTQ plus was related to well-being, and how the pandemic affected students' academic experiences. So thank you so much for your time, and thanks again to InCHIP for the support of this project.
Thank you, Eva. Really interesting study, particularly intrigued by the statewide policies and the impact of those. Hopefully we can discuss a great deal more of your study in the Q&A. I now want to introduce Becky Akupchuk. Always screw up your last name, Becky. Sorry.
Okay.
She's a postdoctoral research associate in the Sharp Lab at InCHIP, and she's going to present on evaluating UConn student well-being in response to the COVID-19 pandemic, preliminary findings, and she will introduce the large team that is involved in this study.
Hey, hi, everybody. My name is Becky. I'm a postdoc at InCHIP. And as you can see, we do have this really large team of investigators on this project. I'm not going to read all of the names because they're right there for you, but this is hugely a team effort. And really, this project came together because there's so many different researchers and so many different departments that were really interested in understanding the impact that the pandemic is having on UConn students. So the goals of this study are really to focus on the students here at UConn. Beth did a great job of really showing why this age group is uniquely affected, especially when students are in college too. You know, they had to go home, adapt to online classes, like their normal way of life is really impacted more so than a lot of other groups. So the purpose of this study is to really look at the impact on both mental and physical well-being, and on behaviors, health behaviors, prevention behaviors, and also to explore student needs to be able to understand and get some feedback from students on how UConn could really better serve them during these difficult times. So the study design is, we're conducting a longitudinal survey that's running across, right now, currently scheduled to run across 20 weeks. We started it in June. We have over 1,000 participants in the study so far, which includes undergrads and grad students and postdocs. I'm just presenting on undergraduate data today. The enrollment for the study is currently ongoing. Now, when a student enrolls, they first fill out a baseline survey. It takes them about 10 or 15 minutes to do the baseline survey. And then they will get mini surveys 3 times a week, which are delivered to their cell phone. That only take about like 3 or 4 minutes to complete. And we're going to be showing some of that longitudinal data here today. When the study completes, we're going to give a final survey, which is similar in length to the baseline. This is just a sample of one of our recruitment flyers that we used. So we used Facebook, Instagram, Reddit, the Daily Digest. We also advertised through different departments here at UConn, campus groups, cultural centers. In terms of undergraduate participants, right now, we currently have 643 that's what we're presenting the data on, that number today. That was downloaded in early September. And you could see the breakdown for the different classes. Also noting that there's 74% of them are females, which is actually pretty common in survey studies that more females will participate in these types of studies. That is just kind of a limitation to note. In terms of the demographic background and race and ethnicity, we see the breakdown here. For the analyses that we conduct, we ended up just dichotomizing race for the purposes of our presentation here today into white and non-white. So this is just kind of a map of the results that I'm going to talk about today. We're going to look at the perceived impacts of COVID-19, the prevention behaviors, the impact on mental health, and then we'll get to the student suggestions. For perceived impacts, we created these composite measures, and what I'm showing you here right now is just a graph of the mean levels across these different composite scales, so that way you could see the relative impact that the students felt on these different categories. And we see that financial hardships and mental health were the two that were impacted the most. We also ran regression analyses on all of these composite measures to be able to look at what factors are really creating differential impacts on all of these composite scales. And the regression analyses that were significant that I'm going to show you today are going to be about exercise, mental health, and general health. So first, looking at exercise and barriers to exercise, we saw that those that had preconditions felt that there were greater barriers to exercise due to the COVID-19 pandemic. Now I have these arrows in a different color because these have a negative slope. So those that were conservative, white, and male felt less barriers to exercise due to the pandemic. Those with preconditions also felt more negative psychological effects from the pandemic. Those that were conservative felt less negative psychological effects. Those with preconditions, again, so we see like a recurring theme here, right? That preconditions is really associated with all of these impacts so far. So those with preconditions and those with personal losses associated with COVID-19 had more negative health effects overall. And those that are white had less. Now we're going to take a look at prevention behaviors. So the first prevention behavior we're going to take a look at is how often do students wear a mask when they leave the house? We found that having a greater behavioral efficacy in wearing face coverings was significantly associated with more frequent mask use. So basically saying that if you believe a mask works, you're more likely to do it. Less frequent mask use was associated with only knowing mild COVID cases and being male. The next prevention behavior we're going to look at is a category we called frequent sanitizing. So this involved all of our measures that had to do with hand washing, wearing gloves, sanitizing the phone, groceries. So this composite scale of frequent sanitizing was associated, had a medium effect on, sorry, I'm mixing up my direction here. Greater perceived efficacy of sanitizing behaviors predicted more frequent sanitizing, and that was a medium significant effect. We saw a differential effect on race with this as well, with whites reporting less sanitizing behaviors. The next prevention behavior that was grouped together was having non-essential exposures. So this has to do with visiting a friend's house, driving in a car with friends, going to restaurants, beauty salon, that sort of thing. And again, you're starting to see a theme emerge here that having greater behavioral efficacy in distancing was associated with fewer exposures. So again, believing that it works, you're more likely to comply. And just a little deeper look into this, those that had greater perceived immunity and those that wear a face mask also were associated with fewer non-essential exposures. And conversely, those that had jobs in contact with people and those that were white had more non-essential exposures. Oh, I should point out that there was a lot of factors that were being controlled for in those regression analyses as well. So now we're taking a look now at mental health over time. So this is just an example of one of the questions that was assessing perceived risk, which is stated, my chances of getting COVID-19 are high. And then you had to either strongly agree or disagree with that statement. And we saw that 24% of students either agreed or strongly agreed with having a high risk of getting COVID-19. And that data is from week 12 in our study, which is the week that classes started. So with our data set, we have the ability to really look at trends over time. So a lot of these measures in our mini surveys are being asked each week. And then we have so we have 3 mini surveys a week. So some of them have repeating measures and some of them have different measures that we're able to kind of throw in during those mini surveys. So one of the things that we're looking at over time is anxiety levels. And we see that there is some different trends over time, and looked like there were higher levels in June, and it went lower in August, and then went up when classes started. And currently, at least in mid-September, as of this data set, was going down again. But an overall trend you see as increasing. At the start of classes, 31% of students reported feeling anxious either very often or all the time. So with our data set, we have the ability to look at patterns over time and also compare different patterns over time. So we could overlay anxiety with perceived risk. And surprisingly, these graphs look very, very similar in trends. Those regression lines you could see are like practical, or the trend lines are practically almost on top of one another, which was an interesting pattern. So now we're going to take a look at some of the suggestions. So we had 288 responses from students. We've been putting them into different categories, which are generally grouped into these 4 categories of emotional and physical wellness, ideas for safe social distance events, ideas for help with assistance in financial issues, and academics and job-related items. I'm going to just show you a list of the student suggestions here and let you read them for yourself for a minute. So in summary, we've seen that the pandemic is dynamic. It's changing over time. And we have this powerful longitudinal data set that gives us the ability to track changes in behaviors, to track changes in mental health, track changes in physical health, and preventative behaviors over time. So this is a really, really rich data set that we have on our students here at UConn. The way that the surveys are set up, it's allowing us to respond to current events. So I mentioned how we have in one of those mini surveys that we're kind of changing up the measures over time, and that allowed us to respond to the protests and the Black Lives Matter movement over the summer, where we were able to put in questions about anti-racist attitudes and behaviors and beliefs into the questionnaires. And in terms of themes that we've seen emerge, clearly efficacy does matter. So the more people believe that these preventative behaviors work, the more likely they are to do them. Now, we've also seen the impact of race in prior conditions. Now, we know that minority populations are taking a harder hit from the pandemic as a whole across the country. But what this research shows is that this is actually true here at UConn as well. from our student suggestions, we have lists of suggestions to help address the unmet needs of the students in terms of more ideas for ways to support them with mental health. They're really seeking out new ways to connect virtually and proactive initiatives. Future opportunities, if we were able to continue with these surveys with more funding, we could potentially continue this for the entire academic calendar, which would allow us to look at the impact of quarantine and testing, the differential impact on stigma for different groups, and also look at the impact of current events and misinformation. So here is a list of the large interdisciplinary team that contributed to all of this work. And I'd like to thank all of the contributors, as well as the help from our students and the funding from InCHIP. So we are the UConn Be Well study, and we are still recruiting participants. Thank you very much.
Thank you, Becky. That's a really exciting study with lots of potential, particularly if it continues through the entire academic year. Building on that study, because we did partner with another team for this study. Kaylee Liggis she's a graduate student with HDFS. She's going to present on the disruptions in the medical management and care of college students with pre-existing mental health conditions during the COVID-19 pandemic. Go ahead, Kaylee.
All right, good afternoon. My name is Kaylee Liggis. I'm a PhD student in Human Development and Family Sciences. I, along with my PhD cohort member, Emily Fritzen, and our advisor, Dr. Keith Belizzi, are here to present the research we conducted as part of the Be Well study. We wanted to understand how students with a pre-existing mental health condition were dealing with the COVID-19 pandemic and provide insight on how we can help these students. So first, we would like to give a very special thank you to all of the UConn students that made this research possible, and we would also like to thank all of the individuals who contributed to the UConn Be Well research study team. We'd also like to thank our funder for this work, InCHIP. So our team was interested in understanding how students with pre-existing conditions were dealing with the onset and changes that accompanied COVID-19. According to the National Institutes of Mental Health, roughly 1 in 5 U.S. adults live with a mental illness, with the highest rates among young adults 18 to 25. Therefore, we believe that this population may be at a higher risk for adverse outcomes due to the pandemic's preventive measures, such as social distancing, moving from campus, and quarantine. In addition, we believe that these measures may have highly impacted our students' ability to manage their mental health conditions or disability. So research has shown that self-efficacy, or the confidence in one's ability to successfully accomplish a task, could have a buffering effect on negative psychological outcomes, such as stress and anxiety. Therefore, we use the transactional stress and coping theory and social cognitive theory to address our research questions. And specifically, our research questions were, how has the COVID-19 pandemic disrupted the management of university students' pre-existing mental health conditions? What is the impact of this disruption on psychological well-being? And how does mental health self-efficacy influence the relationship or mediate between disruption and psychological outcomes of anxiety, depression, stress, and distress? So as was stated before, our study was embedded in the Be Well study, which uses a longitudinal methodology in order to assess the changes in attitudes and behaviors over the course of the pandemic. The data presented here was collected from June to September of 2020 and represents a cross-sectional look at our students' mental health and COVID-19 disruption. At the baseline survey, students who responded affirmatively to a question within the past year, have you seen a healthcare professional to help you deal with a mental health problem or disability that you have, were asked subsequent questions regarding their healthcare experiences, and participants were also asked to self-report their health conditions from a given list. We included several questions regarding disruption to care, which were created by our team for this study. And results presented here also include an adapted version of the Mental Health Self-Efficacy Scale and an adapted version of the DOS-21. To reduce participant burden, the Be Well study asked 3 questions from the DOS, which reflect each broad concept: depression, anxiety, and stress, with the highest factor load. We also used a composite score for these variables to measure overall distress, and for each of these scales, a higher score indicates a higher level of that concept. So our final sample of students who said yes to seeing a healthcare professional in the last year was 258 students, representing 24% of the larger Be Well study. Our sample were mostly white female undergraduate students, and the mean age was 23.5 years old, with a range of 18 to 55. Our sample was skewed white. However, about 1/4 of our sample reported their race as something other than white, and 14% reported being of Hispanic origin. 32% of our students are graduate students, including postdoctoral associates, and 12% of our students graduated in May. And we ran sensitivity analyses to support our inclusion of postdoctoral associates in age outliers. The results reported here are descriptive statistics of the current state of our students' health. 70% of our students have a formal diagnosis for their condition, and 57% of our students report having more than one condition. The most common self-reported conditions were anxiety, mood disorder, eating disorder, and ADHD. 57% of our students seek health professionals outside of UConn, and 30% utilize UConn services and supports to manage their condition. 47% take medication for their condition, and 53% incorporate non-pharmaceutical therapies to help their condition. When asked if COVID has disrupted their care in any way, 65% of students reported at least some disruption. When asked specifically about receiving care from a health professional, 57% reported disruption, 19% reported disruption to their medication access, and 50% of our students reported that COVID had disrupted their access to or quality of their mental health counseling and supportive therapies. Of the 59 students who specifically expressed disruption to their counseling or supportive therapies, 15% reported that they lost care completely, and 35% report that the care they received through telemedicine was insufficient for continuing care. Several students voluntarily answered an open-ended question about their concerns regarding COVID-19 disruption. Students provided us with further detail about their concerns, including reporting insurance disruptions, cancellation of appointments, or losing care due to moving from campus. Some students experienced trouble finding a new healthcare provider closer to home because providers were not accepting new patients or were unable to accommodate telemedicine services. Some students reported that their access to exercise, which had been used as an alternative non-pharmaceutical therapy, had been greatly reduced. And alarmingly, some students reported not being able to see friends or family or other social supports was related to their subjective increases in feelings of loneliness. We believe that this open-ended data was able to provide a greater insight into the experiences of these students, and a particular interest here is that even with social media and access to technology, some participants still reported feeling lonely due to the lack of face-to-face interaction with peers. Of our total sample of 258 students, 65% reported disruption with their care, and when we compared those who reported disruption to those who had not experienced any disruption, we saw that rates of anxiety and depression were somewhat similar. However, rates of stress and our composite score of overall distress were higher for those who reported disruption. We also conducted a mediation analysis using our 4 psychological outcomes of depression, anxiety, stress, and overall distress. We found that self-efficacy mediated the relationship by establishing a statistically significant direct effect reduction when self-efficacy was introduced. We found that this sample of our student population who reported a pre-existing mental health condition or disability have reported disruptions in their care due to COVID-19. 35% of our students who moved to telemedicine report that this care was insufficient, and another 15% lost care completely. We saw that individuals who reported disruption to care demonstrated poorer outcomes, especially on overall distress, And we also saw that self-efficacy in managing mental health mediated the effect of each of these 4 psychological outcomes. Therefore, this research has implications that could have both immediate and lasting impact on all student populations in higher education or for mental health professionals who work directly with this population. University administrators and faculty should recognize the negative impact COVID-19 has had on students who have a pre-existing condition. Past epidemics have shown long-term effects on mental health. Therefore, administrators should allocate resources to enhance outreach in anticipation of compounded feelings of stress and depression. And the UConn community specifically should be aware of and refer students to university resources such as peer-to-peer support or the student health and well-being resources on managing mental health during the pandemic. And because students reported losing care or dissatisfied with telemedicine, the format of remote services should be crafted with consideration of student feedback. Interventions to enhance self-efficacy may help students to manage their mental health, and the university's efforts to minimize the stress for students both on and off campus during the pandemic should be a priority. So we thank you for your time today, and we thank again our students who shed light on these important subjects.
Kelly, thank you so much. Love all the implications for our university and other universities and how to support students in terms of their mental health. Really important. I want to finish. We're going to finish today with Ellie Dougherty, the Associate Vice President for Student Affairs and Dean of Students, Joe Briety, said it right, Interim Assistant Vice President for Student Affairs and Director of Student Activities, and Jen Longa, Assistant Dean of Students for Victim Support Services and Bystander Initiatives, who are going to talk about healthy and safe, building a culture of positive behavior during a pandemic, and like what they've done that's so fabulous at UConn, because we're doing really well here. I don't know who's going to start. I'm going to let you guys decide.
Yep, I'll get us started. And Debbie's right. We are fabulous. But we're fabulous. And what brings me here today is because we've integrated research into our practice. And I will tell you that our platform in planning for COVID was to take a public health platform and apply within that a behavioral health strategy. So that is to say, we took all of our good science through the medical community, through public health models, and through epidemiology to provide systems of care for a population rather than a few. But we created a climate of participation through all the expertise that we got through our partners in InCHIP, and Debbie was certainly one of them, and Amy and Lisa and so many others. And it's from that that you see the actions of the university in real time, but that I learned from every presentation that's preceded me. I'm going to call out a few highlights and then ask my colleagues to chime in. But you'll see that our approach has been one of transparency and honesty, one where we present what we know to our students, one where we advise our students on how to make informed decisions to preserve their own health and the health of others, and one where we do this in collaboration. This is not a top-down public health model. This is all sides converge to make sure we are providing for the greater good. And that is exemplified through something that we created together called the Yukon Promise, which talks about not only the need for a public health model, but a need during a time of, I think, identity questioning and a political climate that is not overly encouraging to the well-being of others, that we also take on a role of advocacy and racial justice as well. We also wanted to, and I'll be putting these things into the chat so you can look at them live to see what was articulated and shared with others. We also wanted to publicly share information. I just had a meeting with Hans, with some of the leadership from the Trump administration on COVID, and dashboards were called out right away as something that was really critical. And so, as you know, we've created that for UConn so that there is a day-to-day presentation of data on how we're doing in our health and what that impact is upon not only our student body, but our faculty and staff, and of course, the greater regional population as well. And then being very explicit with students about what we needed to insist upon for behavioral change, but with the hope and the intention that we did this together, that we created inspired participation rather than enforcement. And that was articulated very explicitly within our residential community, and then more broadly to all members of our community through messaging from the provost, myself, and others. And together, I think you're seeing a pretty successful approach at being one of the larger residential populations in New England and the Midwest right now, and also one of the larger schools for in-person learning, where we're hitting around 30% with some variance on campus. Avery Point is higher than that. And together, this spirit of we persevere, but based upon that knowledge that InCHIP gathered in the very beginning by doing things like the thought exchange to understand the student desire to return, and then what was necessary to prepare for a safe environment. So with that, I'm going to ask Jen to speak briefly about another partnership with InCHIP through the creation of peer-to-peer models in the ambassador program. My colleague Hans Reinhardt to talk about a strategic approach to compliance and not enforcement. And he'll tell you more what he means by that. And then we'll close with Joe and this very important point of community and connection and well-being that's been coming up in other presentations as well. Jen.
Great. Thank you, Ellie, very much. So I was part of a committee that was formed with members of InCHIP, Mental Health and Shaw, Residential Life, Regional Campuses, Student Activities, Faculty, and a grad student and undergrad. We put together a program that we then named Peer Ambassadors, PAC Ambassadors, based on the model of the PAC leaders and the Protect Our PAC concepts we've used already around bystander intervention. We recognize that students hear messaging better from their peers than they often do from us grown-ups. And so we wanted to make sure that they were utilizing themselves. Plus, looking at what InCHIP had discovered about students really had this goal of getting back on campus, of getting back together. How could we best do that for them? So we created this program with the idea being that the students involved, the PAC ambassadors, would be visible members of the community that helped each other to make good choices around being a member of the community, how to wear a mask, how to safely distance, how to use all sorts of things. As the students came together, we also realized, and they said they wanted to address the idea of loneliness and separation and mental health issues. So we created an initial training. I trained the 294 stores RAs, who then became PAC ambassadors. We reached out to groups across all of our campuses and got a list of other students who are peer leaders, who are already identified as students who may be interested. An additional 49 have now been trained through 4 different training sessions. So we have a total of 343 PAC ambassadors. Of that group, 24 then reached out and said that they wanted to be lead ambassadors. So they are now coming up with new programs of how do we move forward. The methodology we used in the training was utilizing not only bystander intervention, but also motivational interviewing theoretical concepts, and that Protect Our PAC model with interactive training around scenario-based. Their current activities right now, I had a meeting with 11 of them, the leaders last night at 9 o'clock, just before 9 o'clock, because we wanted to watch the debate. But we talked about some of the plans they've already have and some of the activities they've already started, is doing that direct interaction with their peers, both remotely and in person. The students who are PAC ambassadors are both remote and in-person students. They're graduates and undergraduates, and they represent all of our campuses. They're doing a lot of social media messaging, including they're about to start a day in the life of, which is an Instagram and TikTok takeover. And so one PAC ambassador will do what is it like to be a student during COVID. They're doing those interactions, as I said, reminding students safety. The regional campus ambassadors are working on a virtual town hall, which is being sponsored by the Stamford campus, that will include these messages along with the theme of wellness. They are also speaking in FYE classes and doing other great things. So thanks, you, Jen. And I pass it on now to Joe. Sorry.
And Hans, I'm the disciplinarian, so Debbie doesn't get trouble, so we'll keep it to 2 minutes.
Okay, thank you. At first, I'd also like to thank InCHIP and everyone that's been involved. Although I haven't seen many or all of you personally, Ellie has really broadcast your work to me, and it's very interesting to see that the work that you do can actually be translated and transferred into line first responders, police officers, and firefighters, and helping them do their work during this time. So I want to talk about compliance, not enforcement. Early on, when we were developing our plans on gaining compliance with mask wearing and social distancing, the word enforcement came up often. And I kept changing the narrative. I wanted to move away from enforcement and move toward compliance. And what many folks may not know is more than half of the Division of Public Safety consists of people that are in the compliance field. Our folks in environmental health and safety who work with lab safety, lab compliance. Our folks in our code enforcement, building and fire code work with compliance. And I spoke with them, and one of the key ideas that they gave me was to be consistent and communicate often what our expectations were. And we would be able to, if we're looking to mitigate and reduce the spread of disease, and part of that is through mask wearing and social distancing and some of these other tactics that have been developed, we need to be consistent and clear in what we expect people to do while they're on campus. And that's the approach that we took. We have not issued any formal enforcement action. We haven't monetary fine because we felt that we haven't needed to, based on the interactions our police officers have had with primarily students on campus. We have started a program where we have enacted directed patrols to officers that their sole purpose when they come into work during high activity areas is to have community engagement. And we try to facilitate that with things, dairy bar ice cream coupons, T-shirts that say, "I got caught wearing a mask," little funny sayings that help, one, the officer feel a little bit more comfortable walking up to a group of students so they don't feel like they are the enforcer walking up. And it also allows the students to understand that we're there in a more helpful way than in an enforcement manner. We also know that as the trajectory of the disease changes and as we start going into colder months and people start congregating indoors more, we may also have to change our approach. And we are always looking at different messaging and different ways that we can continue to connect with students to enforce that. And I think it's something that Rebecca said is people believe they want to comply if they feel it's working, if it has an impact on them. And that's what I know Ellie's sending me the note now to stop. We believe that. And we look at things that we've done in the past. We look at seatbelts. Most of us on the call right now, you just put your seatbelt on because you think that it has a personal impact for you. We did the same with opioids. We looked at it from a public health perspective. We didn't look at it from an enforcement perspective. And we wanted to have that same approach with compliance with mask wearing, et cetera. Thank you, Ellie.
Thank you. Joe, you want to close this out? Because I know we're going to have some good questions.
Yeah, sure. Good afternoon, everyone, and thank you. I'll be brief because I know I stand between this and Q&A. And so our challenge, as has been kind of referenced throughout the conversation, was how do we build community given everything that we were experiencing and we knew students would be experiencing. And I think everyone on this call probably recognizes that it was forcing us to take the institution and various aspects of the institution and turn it inside out from an organizational model that is predicated on bringing people together in large numbers in residence halls, dining halls, classes, and activities across campus, to creating community in a different environment, in smaller environments. Our efforts largely focused on what became known as our Kindness Initiative, which grew out of our work in the spring, which frankly we pulled together in the spring quickly to keep students connected when the university closed. But we then spent the summer reimagining kindness and really building it out and allowing it to mature and evolve. And a lot of that was with the help of folks from InCHIP, including Debbie and Amy. And so I do want to give that shout out. Kindness became a centralizing place and a clearinghouse of information for students related to how to build a civil and respectful and inclusive community, to how to remain connected, staying healthy, how to survive the 2-week quarantine, residential quarantine period, and things to do to keep them engaged, and a whole host of other information and offerings for students so that they felt connected, they felt informed, and they knew where to go to get information on a variety of topics. I think this was particularly important for our first-year students who are new to the university and maybe weren't quite sure what they were stepping into. And so we needed to be particularly sensitive to that subpopulation as well. And so we offered initially, actually before students arrived, about 2 weeks before students arrived, we even started an online live chat, peer-to-peer online live chat that invited students to connect. And again, particularly our first year students, to meet other students, to find out about programs and departments and offerings across campus that might be of interest to them, even during a pandemic, and get them in touch with folks and offices and staff sooner rather than later. And this turned out to be a very effective tool, one that students used quite a bit. And then we did our best to, again, rethink what we do and provide as many online and remote opportunities to students during that residential quarantine in the first week or so of classes. It provided us great opportunities to actually connect and work across the institution in ways that we've never done before, including breaking down some of the geographic barriers that come with our regional campuses, and really do some cross-promotion of events and invite students across the board. We learned quickly after the Labor Day weekend that students, as much as they participated in high numbers in our virtual online offerings, were tiring of them as well. And so we pivoted quickly to more small in-person offerings. And I mean small, from a campus that is typically, that is used to hosting concerts and comedy shows of several thousand students. We were breaking down into s'more nights of 12 to 15 students and whatnot. And so we have continued to pivot in that direction and roll out more and more in-person opportunities in a safe and reliable way, and also try and break down the students' comfort or build up the students' comfort level in coming out of their dorms and participating in them. I think maybe I took some of my time, so I think I'm out of time, and I will turn it back over to Ellie and Q&A.
Yeah, and I'll just, to maybe be a little provocative, this all comes to a head when you think about Halloween and a national election coming up in a few weeks. All of it, connection, mental health, well-being, community, public health, safety. As we look ahead, that's it. That's our convergence point in the next few weeks, is how we bring this all together. So thanks, everybody. Really appreciate the partnership and the chance to speak with all of you.
Yeah, first I want to, it's a great informative presentation from the four of you. I can't believe you fit it into that short period of time, and I want to commend you on the work you're doing again. And I think the model of administrators, staff, and faculty working together is innovative, one that we should continue. I think we should talk about how we can proceed with that. I do owe Hans apology for not introducing him. I guess I wasn't clear he was presenting, but Hans Reinhardt, Associate Vice President and Chief of Police from the Division of Public Safety. My apologies for that. So I do want to open this up to people for questions to control this. If you could raise your hand, you will see to the right of your name under participant a little hand, and if you click on that, and then I'll call on you and you can unmute and mute yourself so we don't get background noise, etc. Be happy to get this going. I know Amy has a question already. So Amy, did you want to ask your question?
Yeah, no, I was just thinking of it, I think when Joe was speaking. So, and some of the groups may have touched on this, but do we have evidence that first year students are more at risk for poor outcomes? Are we seeing that they're having a harder time connecting since they're not coming in with established, social groups and experience on campus?
We are seeing it. We don't have evidence of it. And I think the learning curve, and then Joe articulates this really well about things that naturally happen over the course of your first semester in college that are not happening. But I think the group that has been hardest hit has been the entering first year student and the families. because whether scientifically accurate or not, the thought that we were opening came with that. The thought of the college experience they had would be the college experience their child had. And we're not able to give that right now. And so it's a very sequestered residential experience, even now when we're open, because we're at 4,700 students when normally we have 12,000, and activities are limited. And so all these accidental and intentional programmatic opportunities to connect and create friendships don't happen as well virtually. And, Joe has some really clear thoughts on that. We just discussed it with my student advisory group too. But I would tell you, and I didn't think it going in. Going in, I thought, oh, this is really special for a first year. They'll be able to be part of a small community, and they would get a degree of attention that doesn't normally happen at UConn. And I would say I've done a clear 180 on that one, that I think they had the hardest time this past, the residential students. Actually, no, both of them for different reasons, but the hardest time. Joe, you have a great way of articulating this. Do you mind?
Yeah, I would echo Ellie's point. We don't have the data, but we have some suggestions, fairly strong and consistent, that when it comes to first-year students, and I'll actually add in transfer students as well, just because I had an interaction this morning with a transfer student who was new to campus and mentioned that he's had little to no interactions with anyone else, save for an early morning program that we run, and that just spoke to me. But in conversations that Ellie has been part of with students this past week, has been kind of this reminder of the fact that we lost the opportunity to break the ice and help students break the ice with some of our our traditional annual kind of first couple of day programs, where frankly we drag students across campus in groups of 25, 30 or more. And I mean drag, as a father of some of those students, you're dragging them from A to B. But it's through the course of that dragging that they're bumping into each other, figuratively and literally. And the ice is beginning to break. They're feeling more comfortable interacting with one another, with strangers, sitting next to them in different conversations and so forth. We didn't have that. We missed that. And we missed the opportunity to help students kind of break that ice and feel comfortable with it. And so now, whatever it is, 4, 6, 8 weeks into the semester, you still have first-year students who don't have the friends network, but more importantly, don't have the comfort level to go out and establish a friends network and the confidence to go out and do so, because they were, as I think Ellie said, they were kind of sequestered. And we did a real good job of putting up a red light and really keeping the campus safe right away. We can do a better job at creating then that comfort to come out of their rooms and to feel comfortable coming out of their rooms and engaging with one another.
And I would suggest that all of that is compounded by the quarantines that are episodically happening. So I'm just talking anecdotally, no data, but I teach an FYE class, and at certain points in my class, half my class has been quarantined. And that has caused incredible stress, sense of isolation, and understanding that these are predominantly freshmen and sophomores. So that's on top of that, initial 2-week quarantine, which you can be doing everything the way you're supposed to, and you still end up quarantined. And I think that's hard for a lot of our students.
I'll just add to this, to an aside to that real quick, is Ellie and I have talked about the fact that it's reorienting staff as well, who have been working from home in many cases, to also feel comfortable coming to campus and engaging in ways. And so that's also been part of this switch that we're working through.
Becky, I think you had a comment.
Sure. Yeah, I was just going to mention that I did run an analysis. I didn't show this in the presentation, but we did look at stress, anxiety, and depression levels of freshmen versus the rest of the undergrads. And we saw decreasing that the freshmen were more anxious coming in, but as of right now, they're actually less anxious than all the other students. But this is something that I would say, take this really with a grain of salt, in the sense that the freshmen are only 6% of the population in our study right now. And I think we would be able to really speak to this much better if we were able to do a big recruitment push to get more freshmen involved in this study. because we do have weekly measures of stress, anxiety, and depression.
Yeah, I want to underscore that, what Becky is saying, how important I think this study is to continue, because we could look at things over time. And if administrators are interested in the study, we could add additional questions because it is a longitudinal study and we can change questions and add questions. So I think it's a really important set of findings that would help inform some of the decisions that administrators and staff are making. Leslie, did you want to ask a question? You put one in the chat, or?
Yeah, it was just a general question of if we continue this study, if we get funding for it, while we've got administrators here within this, what's your wish list for the questions that would help you with decision making as we go forward? You've seen the kind of things that we already have on the survey. Well, a fraction of them actually. There's a whole lot more. But what are your questions? What are your priority questions?
I'll say my first interest is avoiding redundancies in surveys. So I'd want to pool our outreach. So that my first reaction is that. The second is, and this is just more takeaway, and this was, I know there's all kinds of interest in this question that you're raising of mental health and well-being among a population that is already predisposed to stress and anxiety, which we know from a traditional college age population we always worry about. I worry about it more now. And what's interesting is I have more capacity to serve students in mental health, but students aren't seeking it right now. So, and that could be the forum, right? It could be the method in which we're delivering care right now, which is predominantly virtual. It's hard to create a safe space between a therapist and a student where they're 6 feet apart with masks on for an hour-long session. And so I'd be interested in how we can deepen our work in building connection and community from both a virtual and an in-person perspective. Like, what is the underlying need and apprehension? Because I think there's an apprehension about coming together. Joe's red light point had an impact that remains with people, and I worry prevents them from coming to programming that we do. So what is the need for connection and support? How can it be best met virtually and in person? And what is the apprehension to having that need met? So I think there's a lot of people out there who desperately want to come together and connect, but they're afraid of getting sick, or may want to meet with a therapist, but they don't realize there's a virtual platform and we can accommodate them. That's speculation on my part. But when I look at the resources and I look at the need, understanding the distance between the two in this particular setting would be really helpful. Does that make sense?
Yeah.
I'm one of those people who thinks out loud.
Ellie, I do want to say, because I'm involved in the study that Becky and actually Leslie Snyder is too. There's a bunch of us, as you saw. We did, on that question that Becky had presented in a categorized way, there are a lot of individual comments in there that we are willing to share with administrators about mental health, social. Joe, you'd be interested in too, how to socialize, et cetera. So we have, as I said, 288 people gave responses that we would be willing to share with you.
That'd be great.
Thank you.
Especially because we're wrapping our heads around spring right now.
Yep.
Yeah.
And this particular question.
To your point, Deb, and to Ellie's point about looking ahead to the spring, if the data existed, I'd be very much interested in what are students doing on their own in terms of engagement and the relationship of those activities to potential stress and anxiety and feelings of loneliness and so forth. What are those activities that are actually filling needs and which ones are not? And obviously the amount of the various types of engagement in the relationship.
I'm going to reach out to the research teams, and it may be too early in your process of analyzing your data, but what do you think are potential implications for policies and programming for interventions? We've heard some of how you want to go forward in terms of your research, but what do you think in terms of policies and programming at UConn or elsewhere? It doesn't have to be at the college level.
So I'll say one thing that I'm seeing, and I'm seeing this in part as a researcher, but I'm also seeing this in part as someone teaching a 350 student gen ed class that's about half freshmen. And I think in part, I'm worried if the most, or maybe not the most, but I'm also worried about the students who are home right now. Like particularly the first year students who haven't like maybe never met another UConn student, had a one-on-one or group interaction with them. So I keep thinking about ways that we can help them feel like they're getting some kind of a college experience that, you know, you were talking about the on-campus students aren't getting the exact experience they were expecting, but I think the remote students even more so are just feeling like, you know, it's literally all work and no play. And in a group assignment in my class, a student said she made everyone else turn on their videos because she said, like, I will see another college student this week. I don't care if you're still in pajamas, you have to turn on your cameras. But I just think that it's in some ways easier to think about the students who are here because we have them, like, and we can do programming and things for them. But I hope that we can also think about what we can do socially to support the more distant students. I don't necessarily have the answer, but I know that that's another issue to think about.
Yeah, just to chime in real quick, there was a good article about that in the Chronicle today. Eva, I don't know if you saw it, but it had some ideas about creating neighborhoods in classes and smaller spaces where students can get to know each other. It seemed like it had some good ideas.
Yeah, that actually was suggested by some students in our survey, so that's very consistent. So I think Hans wanted to say something. Your hand was up.
I did. Ellie and I had the opportunity this morning to meet with Dr. Deborah Birx, the governor's office, and President Katsouleas in Hartford. And one of the items that she brought up is how can we leverage and maybe flip the script a little bit on more than us as administrators and university officials telling students what we want to happen. How can we flip it so that we can use them as an opportunity to continue to push a message from them into their communities as they start going home into small groups? What Dr. Birx thought the progression of the disease is that it's not going to be so much institutional based, not so much workplace based. It's going to be the small 6-person gathering of people that are familiar with each other at their home that think that they're fine. That, you know, I know she's not sick. I don't need to have my mask on when I'm around her. How do we get that message from the students to their families and back into their communities? And that was one of the things that Dr. Birx brought up, that colleges and universities may help in the next phase of the disease.
Becky, go ahead, and then Jen.
So just briefly, one thing that I noticed in terms of the student suggestions is that a lot of them are suggesting things that already exist. And I think that's just kind of the message of that centralized messaging and awareness and connecting people to things. And I know that that's a recurring thing. And just an example of one is that I teach Meditation Mondays virtually, and I see all this like, oh, you know, it would be great if we had more meditation. And I had 4 people show up last week, you know,
So that's a whole communication piece. I just promoted it, by the way, in my class, but that's because I saw it. So, I mean, that's a whole nother issue at UConn, is how we can better disseminate information. But anyway, I think Jen wanted to say something.
That is the real goal of the PAC Ambassador program.
Yep.
So also, if any of you have students who you think would be good ambassadors, please feel free to send them my way. We're doing it on a rolling acceptance basis. All they have to do is want to make change. It's a very small reach for them, but they are excited to do these kind of programs and to reach out to their peers. So send them and any ideas that you all have my way, and I'm happy to share it with my group.
Ellie, did you have a comment? Your hand's up. No? Okay.
Yes, I did. There's just so many buttons. There's so many buttons and so little time. And I thought I'd play an Amy Gorin and put it because she's the chat queen. And then you picked on me and it was too overwhelming. So I
have a thought. You can check that, Ellie.
I can. I did. I had to choose between hitting return and mute. I had to make a choice. I just think Amy's point is so important and that's what I mean by the gap between the need and the resources. Because I learned, a long time ago in administrator school, the answer is not, but we're doing that. The answer is, why don't you know?
Yes,
that we're
absolutely.
doing it.
Yeah.
And sometimes we default and say, well, it's a communication issue, and no one does communication perfectly. That's always true. I just find more and more now, I'm calling it apprehension. I think Amy called it, being zoomed out. I think we're both right, but there's a different discomfort about taking advantage of coming together that I haven't quite put my finger down on yet, but some of it is just apprehension, that, Joe's pushing his staff to do in-person activities and that trickle show up. But I think it grows with time when we have confidence. And that's why we do the messaging on the health of the community and our current status this week and what are we doing well and what are we doing less well. But there's an arc of confidence that we really need to be thoughtful about as we try to, connect the resource with the need and that gap in between. And I'm always seeking to understand that gap better. And I think it's more complicated now.
I did want to ask.
Can I just reflect, Debbie?
Yeah, go ahead.
Amy, you're supposed to chat.
Oh, yeah, sorry. One quick, I'm just reflecting on Hans's comment about the meeting with Dr. Birx. And I think it's critical to point out that assuming that college students can go home to environments where strong expectations are not in place and expect them to be the agents of change is putting a lot on our young adults. And that one of the reasons things have worked so well at UConn, and I don't want to jinx us, is because we've had excellent leadership throughout this whole process. And so clear policies, clear expectations, a collective effort across, all levels of the administration. And so my answer to Dr. Birx would be, show me the leadership in these environments students are going back to, and we'll show you some success. All right, I'm done.
Well, I'm not going to ask my question because we're running out of time, but any final questions before we go? I think we could talk quite a bit longer. Any final questions, comments? I really want to thank everyone. It's just a taste of the conversation discussion we could have. I think there's so much to talk about, including the research. We didn't get a lot of time to talk about the research, but I appreciate everyone participating, both as presenters, team members, and observers. So thank you so much, and I hope you continue to be involved in our COVID panels, because I think there's going to be a lot more, continuing to be a lot of interesting data presented. Stay safe, everyone.